Good evening. Thank you for being here this evening. My name is Dr. Gerald Trimble, and I am presenting Approaches in Pain, Therapeutic Benefits of Trimble Injection Solution as an alternative to epidural steroid injections. Epidural steroid injections have been used for many years. This dates back to 1885 when Dr. James Leonard Corning attempted to inject cocaine into the epidural space for anesthesia. This has progressed through the years, and in 1952, the first recorded injection of corticosteroids into the epidural space for lumbar radicular pain were performed. ESIs are considered an integral part of the non-surgical management of radicular pain in today's medical care. Epidural and epidural steroid injections are utilized to lessen the neurologic pain due to lower back problems, including but not limited to sciatica, spinal stenosis, and radiculopathy. It is thought epidural injections work by reducing the inflammation around the neural structures and providing this powerful anti-inflammatory into the epidural space. Traditionally, this has consisted of corticosteroids. Relative contraindications to corticosteroid therapy include diabetes, fluid retention, long-term corticosteroid therapy, and blood thinners. Epidural steroid injections are absolutely contraindicated with patients who have active infections, those with known hypersensitivity to the medications, and also those who refuse treatment. Trimble injection solution has been used for over 70 years. This was developed by a German physician that has been available in the United States for over 30 years. Trimble injection solution is a multi-component and multi-targeting medication, including 14 active ingredients in low dilutions. The FDA does provide regulation of these natural products. MediNatural's products are manufactured according to good manufacturing principles. I want to emphasize this. These are the same principles that are used for all medications made in the United States. There's similar sterile preparation. The medications are safe, and they have to be manufactured according to these principles. Years ago, there was very significant and severe problems with medications that were manufactured in compounding pharmacies. This is not the situation at all with the MediNatural products. Again, they are manufactured by good manufacturing principles. The Trimble solution has long been utilized. It was essentially grandfathered into the FDA structure for medications that were already proven safe and effective. This dates back to 1938 when the FDA was formed. MediNatural's prescription drugs are made from natural substances. Following homeopathic principles, they are made of therapeutically active microdoses of mineral, botanical, and biological substances. MediNatural's philosophy of homeopathy differs from conventional homeopathy in that it believes in using complementary active ingredients rather than single ingredients to provide more comprehensive relief. MediNatural also uses higher levels of active ingredients. The Trimble mechanism of action is well proven. It involves increasing tissue growth factor, which is an anti-inflammatory promoter, and it involves decreasing inflammatory components consisting of tumor necrosis factor, interleukin-1 beta, and interleukin-8. Again, this slide shows the decrease in interleukin-1 beta, the tumor necrosis factor, and interleukin-8. You can see these inflammatory agents are substantially reduced. This next slide regarding Trimble mechanism of action emphasizes the different mechanisms of action. It's a busy slide, but I want to emphasize that this medication does not work like a non-steroidal anti-inflammatory drug. It is not through the arachidonic acid pathway, and it does not involve cyclooxygenase pathways as well. It also is a completely different mechanism of action from corticosteroid medications. There are, again, 14 different components to the Trimble injection solution. These are all listed and are varying plant ingredients. The safety profile comparison of Trimble injection solution as compared to corticosteroids is quite dramatic. Patients at increased cardiovascular risk, those with congestive heart failure, hypertension, and fluid retention, may have dramatic side effects from corticosteroid administration. The Trimble injection solution does not cause any fluid retention or side effects related to that. Patients with controlled or uncontrolled diabetes can have dramatic effects when corticosteroids are administered. Their blood sugar can rise quite dramatically, and that can be a very serious consequence. The Trimble injection solution has no effect on blood sugar. Corticosteroid therapy can cause multiple effects with other medication, particularly diuretics and potassium, causing fluid retention of sodium and elimination of potassium from the system, resulting in hypokalemia. That's just one example of the many effects on other medications. And again, there are disease interactions with corticosteroids. We all know these. These consist of the fluid retention, edema, and so forth, congestive heart failure, which was already mentioned. Corticosteroids do have a potential to damage joint tissue. This can result in tendon rupture and essentially damage to connective tissue in the joints. Trimble injection solution does not have this effect, and in fact can actually be administered many times without causing thinning or damage to the joints. Now, I must mention that with safety, if there is a known hypersensitivity to a medication, there can be that can occur with corticosteroids or with Trimble injection solution. We figured out in my office that we've been using this product for almost 10 years. We've administered approximately 5,000 doses, and we've had one person have a hypersensitivity reaction. We found it to be very safe and effective. Patient profiles that Trimble is used as an alternative between corticosteroid treatments include patients with diabetes, patients on continual corticosteroid use, patients opposed to corticosteroid medication, and also patients with fluid retention issues. I would like to further discuss the use of Trimble injection solution in my practice. I am a pain management practitioner. I'm board certified in anesthesiology, and I have a certificate of additional qualifications in pain management. I've been practicing for 27 years. I'm in my 28th year of practice. I started using this product almost 10 years ago. I had a representative from the Heal company come to my office and talk to me about these products, and I did extensive research reading about these products, and after doing that, I felt that they were safe and would be effective to use in my patients. About a week after doing this, I had an 85-year-old gentleman come into my practice, and basically he said to me, "I've heard you're a good doctor. I hear a lot of people getting results with your practice, and I have tremendous knee pain. I can't have knee replacement surgery due to my heart problems. The orthopedic surgeons have refused, and I want to know if there's anything else that can be done. He had tried corticosteroid therapy. He had tried the Hyaluronic products, and again, he was in a great deal of pain. And I explained to him that I had just learned about this product, and if he wanted to try using that, I thought it might be a good alternative for him. We essentially proceeded with a series of 3 injections. He had dramatic marked pain relief over the course of 5 to 6 weeks of getting the injections done, and he resumed walking for exercise on a regular basis. Interestingly enough, I hadn't seen the patient for quite some time, and being that he was 85 years old and had heart disease, I thought maybe he had just passed on. About a year later, he showed up in my office and he said, "Doc, my knees have been feeling great. I've been walking 3 miles a day. Can you do those injections for me again?" And sure enough, we were able to do those injections. He had not returned to the same level of pain. He had again dramatic pain relief, and he came back about 18 months later and had the injections done again. That is what stimulated me to use these products and explore their use further. So I would like to read to you the disclaimer that I have on my consent form regarding epidural injections and the use of corticosteroid medications in the epidural space and also Trimble injection solution. As you know, corticosteroids are not approved for epidural use by the FDA, although this has been done for many, many years and has been done in a very effective fashion. Trimble injection solution also has not been approved by the FDA for epidural use, although it has been used for many, many years, and there's thousands of studies that show that it is safe and effective. I do have this specifically written on my consent form, and I do have patients sign this. The medications used for spinal injections and nerve blocks, including corticosteroids and Trimble, are typically not approved by the FDA for this use, although they have been used for decades for these purposes. Basically, I don't want patients coming back and saying they're unaware that the medications weren't FDA approved. We all know that medications are used for many purposes which they weren't intentionally FDA approved for. Case study number 1 is that of a 55-year-old morbidly obese male with type 2 diabetes and hypertension who presents with low back pain and pain radiating down to the right foot for 3 months. MRI reveals a herniated disc to the right at L4-5. He has failed conservative therapy with physical therapy, and despite multiple oral medications, he's been to the emergency room twice for severe pain. He's offered an epidural steroid injection, but his wife says no. Last year he had a knee injection which shot his blood sugar up to 400. We're not doing that again. After reviewing the case and explaining the procedure to the patient, I explained the rationale of epidural injections and the option for the use of Trimble injection solution. He did undergo a series of epidural injections with Trimble injection solution, consisting of a mixture of lidocaine and Trimble injection solution. He had progressively better pain relief. After the first set of injections, he had about 50% pain relief. After the third injections, he had approximately 80% pain relief and was able to resume his activities. He was able to carry out the back exercise program, and he continues to do quite well at this time. The second case study is that of a 52-year-old female who presented 6 weeks after a motor vehicle accident with neck pain and pain radiating down the left arm to the level of the left hand. The left thumb and index finger felt numb. Physical exam revealed marked limitation in cervical range of motion. essentially spasm of the neck muscles and the inability to turn the head more than 10 degrees. MRI revealed a herniated disc at the C5-6 level. Conservative therapy with chiropractic and oral medications were ineffective. She had one cervical epidural steroid injection with a 50% decrease in neck and arm pain, improved range of motion, and improved the ability to carry out her activities. During the follow-up exam, the patient noted all the improvement and she was doing remarkably well, but she complained of difficulty sleeping due to anxiety and feeling jittery at night. She also mentioned that she was having spotting and she hadn't had her menstrual period in many years. Due to the fact that she was having side effects of the medications, and on physical exam it was noted that she was having puffiness of the face, the options were discussed to use Trimble injection solution and avoid corticosteroids at that time. The patient agreed. She understood the benefit and did not want the side effects of the corticosteroid medications. She continued to have 2 more epidural injections with Trimble injection solution and lidocaine. She had marked improvement in her pain. She had 90% resolution of her pain. She was also able to carry out a neck exercise program and return to her activities of working and driving, and in fact being able to turn her head and function normally. The third case study is that of a 42-year-old female who presents with low back pain and pain radiating down to the legs to the level of the feet for 2 months. Physical therapy and nonsteroidal drugs were ineffective. The nonsteroidal drugs, in fact, caused epigastric pain. MRI revealed a broad-based disc herniation at L5-S1. She was offered epidural steroid injection. She refused on the basis that she didn't want corticosteroid medications and also knew they caused stomach problems. She then stated, "My friend told me use some natural medications on her and you use this on her knees and it worked great. I want a similar medication." If you do begin using Trimble injection solution in your practice, you will have these types of experiences. You'll have doctors periodically referring patients to you to use specifically Trimble injection solution. You'll also have patients that hear from their friends that they've had this natural medication and that worked very effectively for them. She underwent the Trimble injection solutions with epidural lidocaine as well. She had marked benefit, essentially 90% relief of pain after a set of 3 injections. She was again put on a back exercise program and returned to full function. There are a series of slides at the end of this presentation that reveal numerous studies showing the effectiveness of Trimble injection solution and Trimble and Zeal in combination therapy. This is a great list of reading material if anybody's interested to further their education in this regard. I would strongly encourage you to open up this modality for your patients to treat patients with difficult problems, including diabetes, congestive heart failure, and fluid retention. Thank you very much for attending this evening. I appreciate your attention.